Hi, my name is Rebecca Lopez, and I decided to do my health educator presentation on Dr. Tyron Buckley. First, I'm going to give you some information about her background. She was born in New York and moved to Kissimmee, Florida, where she graduated from Bishop Moore High School in 2003. She has a Spanish background. She's Cuban and half Puerto Rican. Once she graduated from Bishop Moore, she became a Gator. When she initially started at the University of Florida, she was a pre-med major for the first 2 years. But during that time, she had some struggles with her courses and was put on academic probation. From the interview and what she told me, she said it was really difficult for her to adjust to college life from moving home, moving away from home. And she was a little bit more focused on working instead of going to class. So she found out, that adapting to college life was more difficult than she thought it would be. So one day she walked into uh, to the health education and behavior advisor and wanted to see what the program was about and to see if this would be the right choice, because she wanted to help people and she thought, well, let's check it out and see what's going on. After talking with the advisor, she had to retake the courses that she didn't do so well in to get in the major. So she dedicated her entire semester and she got A's in the classes that she didn't do well the first time. And that's how she got into health education and behavior. She also joined ESG to build up her resume during that time. But after that, she graduated from the University of Florida with a Bachelor of Science in Health Education Behavior. She continued into her master's program with health education and behavior. And, like the most of us would hope for, she also got her PhD in health education major. She did mention that, that it was advised to her that maybe she should have done the same, degree in all her bachelor's, master's, and PhD, but I don't think she would have it any other way. So the next one. So while she was in school for her PhD, the bulk of her coursework was in nonprofit management. That's where she got specialized in. All of her work was geared towards becoming like a program planner and evaluator. And her interest of topic was preventative care as well. Her first research job was at the UF Foundation and a research house. It was her first undergraduate job, which influenced her to work with nonprofits even more. At the UF Foundation and research house, she'd read newspapers to get background information on people who were potential donors. And this was really helpful when meeting with potential donors because that way when they meet in person, they would know how to, have similar interest topics to talk about, and it would help guide the conversation. And this was her first, dab in research. Then she started, she got another job while she was doing her PhD, and she began working as the athletic director for Girls Place. Oh, I already said that. She began in 2008. It is a nonprofit organization. It's the Girls Place. It's a club for girls between ages of 15 to 18, and it's a nonprofit organization that basically gives a place for girls to go to after school. They have all different types of activities and sports, and even camps during the summer. Um, some of her job descriptions were, build sport programs, budgeting, and grants. She had a lot of responsibilities at Girls Place. Um, she would even help with like bookkeeping, um, with budgeting and cost analysis. She did grant writing, and which was one of her specialties in it. She would good. She was good at implementing the program and making it in a way for people to understand um, uh, what she was trying to get. Since it was a nonprofit organization, they slowly relied on money to help with that, and they loved her for it. She said that they were her. She was the go-to girl to do that for. But she collected and analyzed primary data for use in the grant management, and she also did start the volunteer recruitment, training and management, and retention program at the Girls Place. So she did a lot there. After um, the Girls Place, she left. Um, After evaluating her life and her job, she decided to leave her position at the Girls Place to pursue, something else. She was employed for about 5 months and was working, odd jobs here and there. One which was a babysitting gig for her friend. One day, her friend who worked at the TB center approached her and asked, aren't you a health educator? And she told her that there was a job opening soon at the HIV and AIDS group, and to see if she was interested in it. She was excited for the opportunity to get back in the field, and she said, okay, well, let me apply for it and see how I feel. Well, she got the job and accepted it as a part-time so she can test the waters. Then she eventually, she loved the job and applied for the full-time position, and got it. So now she is there. She is technically now the official coordinator for the Florida Caribbean AIDS Education and Training Center. So, what her job consists of is she oversees 21 different counties in the state, basically the entire state of Florida, except for Miami and the Keys. And one of the things that she loves about this job is this job gives her numerous growth opportunities. And what she's required to do is train doctors, nurses, physician assistants on how to deal with HIV patients. She also prepares them to handle strange cases like, diabetes, someone who's diabetic and has HIV, or someone with TB who has HIV. So, weird cases like that. She gets to educate the medical students herself, or she'll set up a consultation with her. For example, the example that she gave me was that one of her clients requested her to help their medical case managers overcome barriers in filling out the paperwork of uncooperative patients and to be able to develop their care plan more effectively. The case managers, she emphasized how important the case managers need to ensure that the HIV patients are receiving the best possible care and staying on the medication. I mean, that's the overall goal. Like, that's what she, needs to, that's her job. So the patients have to go, since the patients have to go through the case manager first, it's important that the patients be receptive and continue to take their medication and get the proper care and have a good communication with their case managers. One question I did ask her was if she could name a time where she implemented a program and it was successful. She said during her undergrad, she was helping out a PhD student with a project. She was told to develop a lesson plan, implement it, and then evaluate its effectiveness. The lesson plan was made for girls who have been sent to the Gainesville Wilderness Institute. And what the GWI, it's a place where students are sent to because they've been suspended or expelled or who are doing poorly or acting out in school. The class was divided into 4 sections, and her group was assigned the self-esteem and body image as a topic. They delivered the program, and it went horrible, she said. She brought up that one of her classmates, dressed very over professionally, and it threw off the students. They weren't really getting, the girls weren't paying attention, and she said it was just, it was horrible. So what they did, they got the feedback. They asked the girls to be honest with them. And, the girls told them. They wrote down, this and this and, all the changes that they need to make. She mentioned that they didn't really consider, like, the health literacy. And she feels that maybe that's why they didn't like the activities or the brochures that they were giving out. But what they did is they took the feedback from and applied the changes to the presentation and went back for a second time, and it went 100% better than the second time. One thing that Dr. Tyron Buckley learned was that without the input from the target population, you're not going to get anywhere. It was one of the best lessons she has learned from a failure. And one of the most successful ones that she's had. These are just some of many achievements. Okay, so these are some of the achievements. Some of many. The first one is she got nominated of the Spirit of Gainesville nominee for sportsmanship. She, like I said earlier, she started the volunteer recruitment program at the Girls' Place. She is a certified health education specialist. She was featured in the business magazine 40 Under 40. And she's a professor, so she teaches a few courses at the University of Florida, and she got a lot of good reviews at ratemyprofessor.com. I thought that was funny. But overall, though, from what I've learned and from interviewing her, Dr. Tyron's experiences definitely has played a really big part, a significant part in her life, as well as, for many others. She's learned from her mistakes in the past and was able to correct them in order to make her life better. Thankfully, her failures turned into great successes. I felt like I could relate to her a lot because, she struggled at the beginning of her college, and was able to work through it and turn her schooling around and graduate not only with her BS but also a master's and a PhD. The project in her class taught her the value of health literacy and understanding your target population and audience, and that's something that we get taught in our classes, that we have to really listen to the audience and without them, our program planning or implementing, evaluating, that wouldn't be there if we don't listen. But yeah, so she was able to overcome her, her failures with the lesson to improve and make a huge her success. Her time at the UF Foundation Research House has been able to guide her towards the direction of health education and nonprofit work. When she was at the Girls Play, she helped countless girls gain access to activities, sports, and events that they would, never have the opportunity of being part of. And during our interview, I asked her if her ethics, ever her work ethics ever, came to an issue. She gave me a story that, some of their parents, didn't really discuss sex education with them, and sometimes she, had to tell them about things, and it was hard for her to have those conversations and not and not being able to I guess express the way that she wanted to. She would tell their parents that she had the conversation with them. Sometimes she got good responses, other times she didn't get not so good responses. And that's, a difficult thing for people to do, to be able to talk to someone about that subject with other people's children. And I thought that was very, admirable of her to do. But she also learned how to, was capable of handling and what she was willing to put forth for the company while she was at the AIDS Education and Training Center. Well, she is there now. When she finally settled down with the AIDS Education and Training Center, where she provides training to the staff about HIV and AIDS patients, since it's such a sensitive topic. And without her doing that, I mean, I don't think a lot of jobs could be done properly if she wasn't there to help those. And her selfless actions reach further than just her and her family. They extend throughout the entire state. I'm really grateful that she gave me the opportunity to speak with her about her experiences as a health educator. And I want to thank you, Dr. Tyron Buckley. And that is it. Thank you.